My name is Joan Matthews-White, and I'm a patient or an Alberta resident who has back pain. I injured my back skiing, and I did a very high-risk maneuver, chasing my young kids down the hill, and I jackknifed forward. I actually thought I had ruptured all the ligaments in my knee and in my ankle, but as I recovered, I was basically able to get up, put some weight on it, and ski down the rest of the hill. From the time I got injured to the time I sought treatment, the world was switched upside down, so I couldn't leave the house. Obviously, I couldn't work. I couldn't take care of my 3 children. I was literally on the floor of our living room. I had to call in to cancel all my appointments, step away from all my activities, send my notice in, and go on long-term disability. So all those things added up with no sleep for the first 8 days, and I had my resignation in. Resignation for life, resignation for mom, resignation for job. From the time of my initial injury to the referral for a surgical consult was close to 9 months. I had the surgical consult, and we agreed that they thought surgery could help with some of the signs and symptoms I was still having.
I'm Linda Woodhouse, an associate professor here at the University of Alberta in the Department of Physical Therapy, Faculty of Rehab Medicine, and I'm the David McGee Endowed Chair in Musculoskeletal Research, as well as I serve as the Scientific Director for the Alberta Health Services Bone and Joint Health Strategic Clinical Network. About 85% of Canadians at some point in their life will experience an episode of back pain. And so back pain is common, it's normal, and our challenge is how do you sort out the ones that are abnormal and need extra attention from the absolutely normal consequences of having an episode of low back pain. It's really important to understand that patients are afraid when they come through the system. The pain is overwhelming. We deal a lot in orthopedics with people with hip pain or knee pain or acute knee injury, and there are ways that you can take pressure off that and settle it down. With back pain, it's totally disabling. In fact, it's the #2 reason for disability worldwide. It's the #1 reason why patients go to their family physician. It's a really disabling condition, both economically, for society, and more importantly, for the individual going through that. The challenge is we're not sure, am I in the 10% that's going to go on and have continued problems and need surgery, or am I in the other 90% that this will resolve? And people don't have a good way of teasing that out for themselves, and that's where they rely on help. So the backlog of patients is simply the volume coming in for care, not knowing, is this something like a cold that will subside in a little while, or is this something I really need to seek medical attention? And when it's you and the back pain is that aggravating, when it comes on so quickly and is so disabling, you automatically seek help. You want to go for an MRI, diagnostic imaging, something else to really solve this problem. SpineAccess Alberta is aimed at an interface or something between a family physician and a specialist. The patients are telling us if they wait for a long time, see a specialist who says you don't need back surgery and sends you back to the family physician, the family physician says, great, but now what do I do? And the patient's waited all that time and now they're chronic. So it's a worse situation. So we're inserting a multidisciplinary team between a family physician working in concert with them and a specialist, a place that individuals can go for a comprehensive assessment to determine a plan. Do they need to go to the ER? Do they need to go with further diagnostic imaging? Do they need to see a specialist? So instead of everybody in the queue waiting to see a specialist, we're triaging those quickly out who need to see the specialist immediately, and the others, we have a plan to manage them conservatively, and currently that's what's missing. If you need surgery in this province, you can get in eventually, but we're lacking in a plan to get the ones quickly to see the specialists that need to be there, and we're lacking a plan for the other 90% with back pain that don't need the specialist, that need to learn how to manage their own back pain, because they will have, in all likelihood, episodic experiences in the future. And so that's the system that we're putting in place. We have, as colleagues working on this project with me, Dr. Greg Kawchuk, who is in the Faculty of Rehab Medicine as well as a full professor, and he's also a Canada Research Chair in Spine Function. And we're working with Leah Phillips, who is a colleague who's the Assistant Scientific Director for Bone and Joint Health Strategic Clinical Network. And it's really not the 3 of us, it's an army out there. So we actually have about 35 investigators on this project. Well, this is a great opportunity that we haven't seen anywhere across Canada, or to my knowledge in other countries before, and that is truly a partnership between Alberta Health Services and Alberta Innovates Health Solutions as the funding agencies, where the partnership is aimed at changing the healthcare system. It's a partnership for research and innovation in health systems. And it's truly a partnership that's come together where we can access the funds that we need to set up an evaluation structure, which is saying, if we go with this new system, do we get patients access faster? Is it better quality of care? And is it more cost effective to manage it this way? And we have evaluation strategies in each of those domains. My hope is that we can really truly impact the system, that it's a better delivery system for back pain patients, that we work together. We have the data that we need systematically collected to drive an iterative process to make good decisions, and that we really make a difference to patients with low back pain. And making a difference means getting them to the right provider at the right time for the right care and as fast as we possibly can.